And here we go. Welcome everybody. This is Dr. Jeffrey Hanna here at Clear Chiropractic, bringing you today a video on TMJ. So we're talking about the jaw and the relationship it has with this area, particular emphasis on the upper neck. We're going to be giving you a bit of a gloss over, but some of the deep dive into the different ways that the jaw can affect your neck, but also the neck can affect your jaw, showing up in a number of symptoms you would not ever think is connected with that. This can be not just clicking, grinding, popping, but also headaches, migraines, dizziness, anxiety, lots of different things here. Please make sure that you share this video if you've got a friend or a family member you think could benefit, and if you haven't already done so, please click that share and subscribe button. That way other people can find this information. And this is a topic that's particularly dear to my heart because unfortunately this is something that I have experienced very much personally. As a bit of backstory, I was born with forceps, so I had some damage to the shape of my skull from the day that I was born. Fortunately, I was able to have chiropractic care that was able to keep things in check. I had braces when I was a young man to hopefully correct a few things with the bite, but unfortunately, what that did was that set the stage for problems that I experienced for over a decade, from my 30s to my 40s, where every single day I was having severe headaches, if not a migraine. I was feeling constantly dizzy and also feeling a sense of anxiety. It took me the better part of 10 years to completely unscramble all of the different pieces that were going on in my own life. Unfortunately, things are beginning to stabilize a lot better. I do not want to see anybody have to go through that same kind of experience. So number one is, if you're dealing with this in terms of crisis, I hope that this video is going to help you out. But number two, if you're looking to try to protect and prevent something like this from happening in the first place, this is valuable for yourself, for your children. It goes across the board. So let's go ahead, jump into it. I hope you enjoy. All right, we're going to start you guys off with some basic anatomy of a zone that I call the halo. Simply put, it is this band that goes around your upper neck, base of the skull right here. And it's going to include your teeth, your tongue, your TMJ, so temporomandibular joint, that's what we're referring to right here. It's going to include your atlas vertebra, so the top bone in your neck, and also the C2 vertebra, which is the pivot point that allows you to move your head. Simply put, each one of these structures in the halo affects all of the others, and not just the hard tissue, so the bones, but the soft tissues that are deep and on the inside. Particular emphasis on two parts of the brain. First one is going to be the medulla. This is your brainstem. It is where every single one of your vital life functions comes from. It is the master control center for your heart, your lungs, your digestive system, every single function in your body. Also in the halo is what's known as your cerebellum. It's in the very back of your skull. It is the hub that is the primary balance coordination center and also the conductor for all of the other information that's processed in your brain. In other words, yes, our thoughts, our emotions, all this sort of stuff comes up from the very top, but the cerebellum is intimately involved in making sure that that symphony, all of the neurological activity, is working the way that it should be. So these are the things that are in the halo, and again, each and every one of these affects all of the others. Now, I need to start you out with just a few little bit of basic mechanics, because oftentimes people wonder, it's like, how is it possible that your jaw can affect your neck? And also, how can your neck affect your jaw? Well, I've got a few little illustrations for you. Hopefully you can get the idea here. So we're looking at skull right here. This is an illustration of what your jaw joint should look like. So this little bump that you see right here, that's the lower part, the hinge of your mandible, so your lower jaw. And this right here would illustrate the upper part of your jaw. And this purple little thing that I have right here, this is a disc. It's not unlike the cartilage that's in your knee, except it is much, much thinner. And this guy is necessary for your jaw to be able to smoothly glide open. What I've also got over here for you, this would be an illustration. Simply put, base of your skull, that atlas or that top bone in your neck, the C2 and then the C3 going down like that. And these things in the halo are right next to each other. So if you were to simply put, stick your fingers in your ears and open your mouth a few times, you'll probably feel a little bit of movement there. That's where your jaw is located. Now what I want you to do is I want you to come one finger width right behind the back of your jaw. Now what you're actually pointing at is you're pointing at the tip of that C1 vertebra on its side. So these things are 1 centimeter or half of an inch apart from each other. So oftentimes people will say, oh, my jaw is killing me. But what they're actually doing is they're pointing to their neck. Or they say, yeah, my neck is killing me, but then they're actually pointing to the jaw. So these two things right next to each other. But I want you to try this as a simple illustration. What I want you to do is I want you to move your lower jaw only. And what you'll probably do is you'll think to yourself, okay, that's a little bit weird, but yeah, you just allow your jaw to drop down. Now what I want you to do is I want you to try to imagine that you are going to move your upper jaw only. And you're going to do something like that. So simply put, and even if you put your fingers just on the back of your neck, whether you're trying to move the lower or the upper, something like that. I'm over-exaggerating a little bit, but simply put, in order for you to open your mouth, the neck has to engage. So if for any reason either your jaw is not moving properly or your neck is not moving properly, this complex will not be able to move the way that it is supposed to. These two pieces are part of one functional unit. Simply put, again, you cannot open your mouth properly unless you are also moving your neck properly. But there's a little bit more to the story than just that. You see, every single one of us has different anatomy. Our bones are different on both the outside and also on the inside. And oftentimes there are anatomical differences that if we don't appreciate them, we can start to make some pretty severe errors, whether it's working with manual therapy, whether it's working with dentistry. And unfortunately, this is the stuff that can start to set us up for a lot of very complex TMJ related disorders. So what do I have for you right here? Well, we've got a picture of this fine young man, Tom Cruise. And what I've done here, you can see, is I've drawn a little line straight down the middle of Tom Cruise's face. And what I want you to do is I want you to have a look at his teeth. You know, for whatever you might think of him personally or anything like that, the guy is still pretty talented. I mean, he does all of his own stunts. He's doing, pretty good in Hollywood. But what do you see right here? You see that his teeth are not actually straight with the midline of his skull. Now, I don't know Tom Cruise personally. I haven't looked at any of his x-rays or cone beam x-rays, but I'm willing to bet that he has this particular type of asymmetry with his skull. We oftentimes think in anatomy that our skull, our bones are symmetrical. The reality is they aren't. And this particular asymmetry, which is present in varying degrees in about 77% of the population, so it's a huge percent of the population, is where we'd essentially be looking through the base of the skull right here. And we've got this big wide opening, which is where the brain is going to become the spinal cord. And 70% of the time, that little guy is actually pivoted off to the side, a little bit like that. Now, you might be wondering, well, what does this have to do with my neck or with my TMJ? Simply put, joints will align themselves in direct correspondence with this. So if we were looking at a front-on view, the base of the skull, or the base of this opening more appropriately, will align with the tip of the C2 vertebra like this. So if you've ever felt the back of your neck and you say, wow, I've got this big bony bump right under the base of my skull right here, odds are you're feeling the tip of your C2 vertebra. But for you, that could very well be your normal. And if somebody was to do manual therapy saying, hey, we want to push that thing back to midline, guess what? We've actually moved it in a way that's not congruent with your normal anatomy. That, as a consequence, can start making a lot of problems. But again, what does this have to do with the TMJ? It is because the plane that opening at the base of your skull sits, and the plane of that C2 vertebra directly corresponds with the hinge mechanism, the way that your jaw is supposed to move. So with Tom Cruise here as the example, his jaw is not centered midline with his skull. It actually has a slight turn to it. And the result of that is his teeth have naturally and innately adapted to be able to go in that direction. For him, that is healthy and that is normal. But I want you to imagine for a sec that I was an orthodontist who didn't know about that relationship. And I said, Mr. Cruz, you know, you're a very fine young man. You're doing well, but we see that you have crooked teeth. Let's go ahead and put you in braces so that we can straighten out your teeth so that everything is going to look perfect on the outside. The problem would be is that if we end up moving the teeth in a way that is not congruent with his normal anatomy, that unfortunately is going to set him up for all kinds of problems, like I'll show you just a little bit later on. So simply put, our own anatomy to a certain degree will dictate what is going on with our TMJ. But there's more to it than that. This is the particular asymmetry that I have. This is where, because again, I was born with forceps, it caused a shift in the shape of my skull, where essentially one side is going to be tilted like this, and the consequence of that is my jaw actually shifts a little bit off to the side. I don't know how well you can see that in the video, but my jaw actually shifts a little bit over toward my right side like this. And what happens then is the base of the skull has a slight little tilt to it. What this ultimately produces is where the spine is going to have to make certain compensatory misalignments in order to balance the head out. And in and of itself, these are normal adaptations. But again, think of this. Number one is if you were to have certain kind of manual therapies that were designed to try to push things back to midline. Guess what? That is royally going to mess things up. But additionally to that, if you were having certain kinds of orthodontic treatment saying, oh, okay, hey, what we need to do is we need to balance the bite out, but the bite itself is actually in a tilted plane like this, then what may happen is as you're moving the teeth, you may actually move the jaw farther into compression. And oftentimes what will happen with people is the jaw starts to pivot like this. The side that is getting stretched is going to be the more painful side, but the side that is getting compressed is going to start to produce a whole bunch of different very weird neurological symptoms. Headaches or migraines, particularly right here in the temples. It can also produce dizziness, and it can also produce anxiety. And I'm not just talking little bits of anxiety, I'm talking pronounced anxiety. I have seen people manic because what they have is they have a TMJ compression. So again, the neck is going to affect jaw, jaw is going to affect the neck, but we have to take into account our individual anatomy to make sure that any treatment we are receiving is actually going to be appropriate for us and that we are not going against the normal adaptations that are present in our body. Now, this goes back to what happens if either one of these is not moving the way that it should be. So again, we have over on the left, we've got the orientation of the TMJ, and over here, you've got an illustration of what can happen on in the neck. And there's something that I want to point out very, very important on this particular illustration. I want you to see that when we're looking at the normal orientation of the jaw, when your mouth is closed, that you've got the socket and then you've got the hinge part right here, but the hinge is not actually supposed to be sitting dead set middle in that orientation. It's actually supposed to be shifted more toward the front side like this, so that as you open your mouth, there is a huge amount of functional space back here. And this is something, and I'm not trying to call out any dentists because certainly they are more of the expert in this area than I am, but I am speaking from my own personal experience, not just as the patient, but also as the clinician who works with people who have so many of these different kinds of issues. Oftentimes, when dental x-rays or scans are done, they are done with a small little plate that separates the teeth. As a consequence, when we're assessing the openness of the TMJ, we're not actually seeing it in a truly closed position. And as a result, oftentimes where the jaw has actually been shoved backward, it's going undiagnosed. And when the jaw gets shoved backward, that is a big problem because you can see that little disc there, it starts to get smushed. That disc, that little bit of cartilage, contains a huge amount of nerve receptors, pain receptors, and also proprioceptors that go into the brain and that are responsible for making sure that our balance, coordination, and everything is functioning the way that it should. Because if that disc is not going to be sending the right kind of signals, every time that we're chewing, we would be apt to smash our teeth. So you need a huge amount of neural receptors there to make sure that our bite mechanics are going to be working the right way. But if the brain is ever getting abnormal information, that can set us up for all kinds of different problems. So what I'm illustrating here for you is, again, this is what the normal orientation of your jaw should be like with your mouth closed. And anytime you're having TMJ assessments done, it's ideally done with an image where your mouth is both fully closed and then also open. Now, the flip of this is what happens in the neck. And what I've got here illustrated for you, it's a weird picture, I know that, but simply put, we're looking at the base of the skull right through here, and we're looking at the alignment of that top vertebra in the neck relative to the base of the skull. And this little peg in the middle, that's that C2, which again dictates the hingeability of your jaw. Now, any joint in your body, I don't care if it's in your neck, your low back, or your little toe, it should line up just like this. But what will happen is, well, what we should expect is that when you've got your mouth closed, that upper joint should be completely articulated. The two pieces should line up across from each other. But if you're dealing with something where the jaw is getting pushed back, or if you're dealing with something such as an overbite, one of the ways that your body actually compensates is that upper vertebra starts to misalign forward. And I'll show you in a sec why that can be such a bad thing. So your jaw is going to affect your neck, but guess what? It also goes the other way around. If you have ever had a neck injury, even if it's not a major sports injury or a major car accident, you take a trip, you take a fall, roller coaster, heavy metal concert, bungee jumping, trampoline, the list goes on and on and on. If you've had an injury that essentially has caused that upper vertebra to get locked into the wrong position, what it will do is it will actually cause the jaw to compensate by going backward on that same side. I say this all the time for a number of different conditions. Pain is not always where the problem is coming from. There is a big difference between cause and effect. So when we are dealing with TMJ and TMJ related disorders, we need to understand what is actually the primary issue here to make sure that the treatment you're receiving is not just slapping a Band-Aid hoping that things feel better, but it is actually going to resolve whatever the underlying condition is. And this is why this stuff is so important. This picture is designed to be complicated. I'm not going to hit on all of the bits and pieces here, but this is the stuff that's in the firing line with that halo. Your upper neck affects all of this, and guess what? Your jaw affects all of this stuff too. What do we got here for you? So number one, cerebellum. Like I said, this is the balance coordination hub for your brain, but it is also the conductor that allows everything else in your brain to work. The research is coming out more and more that's showing if you disrupt the cerebellum, this is going to affect not just your balance and coordination, but this is going to affect your ability to think. This is going to affect your mood. And if you're a young child, this affects the way that your brain is able to develop into being a normal, healthy adult. That's number one. Number two, we've got a series of clusters of nerves that are in that medulla. Again, the brainstem that is the master control center for all of your vital life functions. In no particular order, well, we'll just go down the list here. Rostral ventral medial nucleus, again, don't worry about the names. This is the filter for the pain sensations that are going from your body up to your brain. If this guy's disrupted, you can't sleep, you are constantly fatigued, and you can get pain anywhere in your body. Nucleus tractus solitarius. This guy receives all of the information from your heart, lungs, digestive system, and regulates all of those systems as well. The flip of that, the dorsal nucleus, this is what controls all of the information that goes back down to your body. And then the last one, the rostral ventral lateral nucleus, this guy controls blood flow in every single artery, every single vein in your entire body, and also in the head itself. Essential for blood flow. If this guy is messed up, you can have all kinds of different issues that, again, you never think is actually affected by this part of your body. Oh, but wait, there's more. Then we actually have not only the nerves, but the processing hubs for each of these. So we've got the trigeminal nerve. This is responsible for pain on the face. This can cause a person to get trigeminal neuralgia, like somebody is stabbing a knife in here. But this is also the guy because the trigeminal nucleus actually descends all the way into the upper part of the neck. This is the guy that's responsible for your headaches, your migraines, your neck pain, all of that sort of stuff. Things that we don't think too terribly much about because they are common, but not normal. So headaches, migraines, neck pain, these are actually signs of an unhealthy brain. You've got the vestibular cochlear nerve, hearing, and balance. This is a big one. The glossopharyngeal and the vagus nerves, these are responsible for your ability to speak, your ability to swallow. And again, it's also the conduit for all of your vital life organs. You've got the spinal accessory nerve. This is your ability to move your shoulders like this. And very common, again, not normal, people will have where one of their shoulders tips like this. And they say, oh, I always need to have my shoulders rubbed all the time because they're so tired, they're sore, and they're achy. That's actually a sign. It has nothing to do with weak muscles or laziness. When the shoulders are tipping sideways like this is a sign, hey, something's actually affecting the brain itself. And then also the hypoglossal nerve. This is the guy that's responsible for how well your tongue is able to move. You've also got all of the C1 through the C4 nerves. This is going to be responsible again for your ability to speak, your ability to swallow. It also coordinates the muscles that are involved with your airway. It's also the guys that are going to be involved with your ability to move your head and also sensations on the head and the back of the neck. And this last one here, very important. I don't want to gloss over this one here. The sympathetic ganglion. These are the nerves that come from that rostral ventral lateral nucleus that are going to transmit the messages for every single blood vessel, in particular, so blood vessels to the brain, but also lymph drainage from the brain. They actually are present in the upper part of your neck. So again, I just punished you with a huge amount of hardcore neurology here. What is the takeaway message from this? The structures of that halo affect not just the local stuff. There are a great many upstream and downstream effects that can show up in so many ways that you never think is actually connected with either your jaw or with your upper neck.